The next speaker is Basem. Is he online? Great. Okay. So Mr. Basem Sahar is a pharmacist and a health programs manager at the Syrian Expatriate Medical Association, or SEMA. He holds an MSc in health policy and global health and is currently pursuing an MSc in health administration. Since 2020, Mr. Basem Sahar has served as the focal point for SEMA's response for older people in northwest Syria and Turkey, working in close partnership with HelpAge International. He has led sectoral interventions supporting older populations affected by conflict, COVID-19, snowstorms, cholera outbreaks, winterization response, and the February 2023 earthquake, with a focus on inclusive health services, chronic disease management, and mental health support. Today, Mr. Basem Sahar will share his work on advancing the rights and health of older people in Syria's humanitarian responses. Basem, welcome.
Thank you. Thank you so much, Elbert. Thank you so much for having me and for giving this opportunity to me to participate with you. My name is Basem Sahar, the Active Programs Manager at SEMA, the Syrian Expatriate Medical Association. I was based in Gaziantep, Turkey, so we've conducted multi-sectoral need assessment and we've conducted multi-responses during the earthquake and COVID-19 cholera response with our colleagues in HelpAge International. Today, and Alhamdulillah, after the liberation of Syria, I'm based in Damascus. I moved from Turkey to Damascus, and I'm talking to you from Damascus. So I'm happy to be with all of you, to learn from you. We'll talk about something about our experience in the field in northwest Syria and in southern part of Turkey during the earthquake. I will be quick, just 7 or 10 minutes, inshallah. So we'll talk about something called Invisible No More, advancing the rights and health of older people in Syrians humanitarian responses. I don't know if you can see the presentation now.
We can see um,
You may continue.
Yeah, could you please confirm?
Yes, we can hear and see you. Thank you.
Yeah, thank you so much. So starting from the outlines, we'll talk about introduction and context, the challenge, the needs of all people, case study from SEMA and the HelpAge partnership, then key recommendations, then some photos from our work, then closing. So just starting with this map from the Turkey and northwest Syria border, you can see here the border between Turkey and northwest Syria, rural Aleppo and rural Idlib. This was our main targets and our main intervention in our collaboration with HelpAge International. So for the introduction and context, SEMA actually is a local non-government organization established in 2011 and registered in 2013 in Turkey. We were mainly focused on health and then protection, nutrition for all age categories. But after our work with HelpAge International in 2020, we've started our work to focus on health of the older people, especially for the COVID-19 patients. Started our work with community health workers in northwest Syria, in Idlib and rural Idlib. And after that, we expanded our work during many responses. And the issue in northwest Syria and in Syria in general, which is there's no focus on this age category. Older people are often invisible in humanitarian response. Yet in Syria, they represent a significant and growing vulnerable group. For example, we've seen about 11% from the 5 million people in northwest Syria was aged people. So we need to talk about this age category and how we deal with that age category and how we've coordinated with the local authorities and the CAMS management just to encourage them to include older people in the needs assessment and after that in the responses. And to be honest with you, also there's something in SEMA and other organizations which is the donors priority, because donors priority in emergencies they focus on something else like secondary health, primary health, maybe more specialized healthcare, but they're not focused on the older people. So we have to change our mentality in this work. We've conducted multi-sectoral need assessment in 2025, and we found something like a high burden of chronic disease. 73% of older people reported at least one chronic illness, diabetes, hypertension, cardiovascular disease, mobility and access barriers. 24% unable to leave home without assistance. Major obstacles include transportation costs and poor facility accessibility, and then mental health and isolation. Up to 35% report stress, anxiety, and depression. 99% never participated in recreational or social activities. And then for palliative care gaps, 54% acknowledged need for palliative support, but only 11% reported services availability quality related positively where services existed. For infrastructure limitations, few health facilities are adapted for elderly, wheelchairs, ramps, assistants, and as SEMA, we had to cooperate with handicap or humanity inclusion just to adapt and to make rehabilitations for our facilities, primary healthcare centers, dialysis center, and even for secondary health centers like hospitals, maternity and childhood hospitals, and in addition to surgical hospitals. For our case study in partnership with Help Age, actually, as I said before, we started in Northwest Syria in 2020 after the COVID-19. We focused on chronic disease follow-up, awareness raising, vaccination at that time. And after that, we go through snowstorm response, winterization, and even for cholera treating centers during the cholera pandemic. And after that, we go through the February 2023 earthquake in southern part of Turkey and northwest Syria. We had to respond to people in rural Gaziantep and Hatay in Turkey, and even for rural Idlib and rural Aleppo in Syria. We had to provide food baskets, awareness raising, something about dignity kits, even something about assistive tools for the older people. And we've initiated recovery home, which was the first recovery home in Northwest Syria, recovery home in collaboration with Help Age International and Idlib Complex Center for Older People, because we had to find something about after the earthquake for these people which was separated from their families. And the lessons learned from these responses in both countries, Syria and Turkey, was the integrating age inclusive health services at BHC and hospital level, introducing palliative care models in humanitarian health after many workshops and training with Help Age International, especially Dr. Favilla and our colleagues in Help Age. And then community-based approach to reduce social isolation. And we have a project will start soon, inshallah, to conduct this experience and to train community health workers to start work on palliative care and community-based approach. The key recommendations after this experience, which are mainstream inclusivity into humanitarian planning, health, nutrition, protection, and other sectors, strengthen chronic disease and palliative care services in BHCs and hospitals, especially for any cancer management and something related to cardio disease and other disease, dialysis disease. Train frontline health workers on geriatric and age-sensitive care, and even, let's say, for caregivers, not for health workers only. And we need to promote participation of older people in designing services, like team leaders, like something in entertainment activities, like something in the need assessment. We need to ask them, we need to interview them, not just to ask the caregivers and the community itself. And we need to ensure data disaggregation by age in needs assessment and monitoring, because maybe you can classify the age people from 60 to 65 or above 60, but in Syria maybe this is something different. Maybe you can classify them above 50, because we have large percentage, as I said, in community. And this is some photos from our work, and this is from one from the favorite photos in our work. This man was hearing the first time after getting or receiving the hearing aid in our center, in collaboration between SEMA and Help Age, and he's smiling after hearing the first voice. And this was from Idlib in northwest Syria, and this picture from Aleppo, which was from distributing wheelchairs, and also in collaboration with Help Age and Age International, after making the assessment and conducting the multiscleral assessment, and then distributing the wheelchairs on for the needy people, older people. And this picture from the recovery home, which was initiating in Idlib as well, some social activities in the recovery home. And this is just to finish what I started. Older people are not invisible when humanitarian actors prioritize their rights and health. We uphold dignity for all, and we need to encourage all the partners and donors to integrate older people in all stages of response. And finally, I'd like to thank you for your listening. Would like to wish you success in your PhD dissertation, Elborg, and for future achievements, inshallah. Thank you so much. Over to you.